since I noticed this rise in nursing strikes, I was curious on how many strikes already happened in 2023. So we're about halfway done with 2023, and there have been more strikes happen than I could really remember for the last, I want to say, 7 years. There's been a lot, and it almost feels like there's going to be more that are going to be happening as things move forward, because I feel like nurses and the system realizing that, hey, if you actually fight for what you believe in, you're actually going to get it. So I wanted to look over some of the hospitals that have already protested in 2023, take a look at what they were seeking and the outcomes. Right off the bat, in January of 2023, 7 New York hospitals started a protest. There was about 12,000 nurses, and their main reason why they were protesting was for better ratios, fatigue, and they just were overworked and they wanted more compensation. After a 3-day long strike, the nurses got what they wanted. They received a change in standards of ratios and staffing requirements. They received better healthcare benefits, and they also received raises for the next 3 years. I believe it was a 5 to 6 and 7% raise 1 year after the other for the next 3 years. So they got what they wanted. So this is definitely a W for the nurses of New York and for these hospitals. They got their raise, they got the better staffing conditions. It was worth it. Then again in January, Mount Sinai in Manhattan, New York, another New York hospital, also protested for inadequate teaching or learning practices in a hospital, unsafe working conditions, low pay, staff shortages, and high caseloads. And the outcome was a tentative agreement with management for better ratios, more staffing, and a 19% raise over the next 3 years. Another W for New York and nurses. Again, in January, 2 hospitals in Michigan with about 300 nurses protested for a unrenewed contract and working conditions. They claimed the hospital was doing unfair labor practices and sneakily avoiding negotiating for a new contract. The outcome was that the strike was averted because management finally decided to start talking, and a compromise was reached, and the nurses got a new 3-year contract. Another win for nurses, and definitely a W for Michigan. In February, South Shore University Medical Center went on a strike with about 800 nurses fighting for better ratios and higher pay. The outcome was that the strike was averted, and the hospital came to an agreement with the nurses for better pay, better ratios, retirement benefits, and also better compensation for holding on to nurses and bringing up the hospital retention for nurses. So definitely a W for New York and a W for the nurses. In March, Henry Mayo in California went on strike with 700 nurses. This was an interesting one because this had a big dilemma with the hospital and administrators preventing contract negotiations. They were trying to basically stop nurses from trying to get a contract. And this is a little bit of a despicable kind of thing, because not only are these nurses fighting against better working conditions, better pay, just a better work environment, this hospital was actually trying to sabotage them from organizing and just not responding to their complaints. They didn't want to just say anything. This was a really big dilemma because this was the hospital trying to just do everything in their power to stop these nurses from saying and doing anything. Pretty interesting. You guys should definitely check it out. This was the Henry Mayo in California. The outcome, it's still to be determined. They're currently in negotiations, but this was an interesting case because it brought to light the illegal bargaining tactics that hospitals can actually try to deploy on nurses and healthcare providers. So hopefully things are going well with this Henry Mayo negotiations. I'm sure they're going to get something that they wanted, especially once they brought out these tricky and sleazeball tactics that the hospital was trying to do. At the end of March, Marine Health Medical Center in California went on strike with about 600 nurses, and their major complaint was that management and administrators were not addressing any of their concerns regarding working condition ratios. It's just they were not addressing the problem that the nurses were showing the hospital, and it was more of like they were just ignoring them. They didn't want to really change anything. So the nurses said, hey, you're going to ignore us no more, we're going on strike. The outcome was that the strike was averted and the nurses received what they wanted. They reached a tentative agreement for a 16.5% raise over the next 3 years. They created a infectious disease department. They upped their safety measures. They also got better health benefits, and they also improved and put things in place that will improve retention of nurses and healthcare staff. Another W for California, another win for nurses. In the beginning of May, St. Rose Hospital in California, as well as a mental health center, went on strike with about 300 nurses for better working conditions, more staffing, higher pay, and also the refusal of management to respond to their complaints and their needs on the unit. About 300 nurses wanted to participate in the strike for better working conditions, more staffing, higher pay, and also because management was refusing to negotiate for a new contract and even renew their prior one. The outcome was that the strike was averted, and there are currently talks and negotiations undergoing for a new contract for the hospital and for the nurses. There is currently a vote going on, and depending on which way the vote goes, they're going to enter more negotiations or they're going to agree on the contract and of the contract's contents. Another win for California, another win for nurses. Also in May, PIH Good Samaritan Hospital in LA went on strike because of poor patient outcomes, inadequate staffing, and unsupervised lunch and break times. Pretty interesting. So this was actually an interesting case because nurses were actually seeing that, hey, the patient outcomes that you guys are blaming on us for not being able to abide by or improve is because you aren't giving us the resources and giving us the staff for us to be able to meet those outcomes. So if you're on the unit, remember, there's always that outcomes committee or whoever the educator is or whoever runs it on the unit always comes and says, hey, we got to improve these outcomes. And this hospital, Good Samaritan in LA, got sick of it and said, hey, outcomes are dropping and you guys are pointing a finger at us, but the reason why these outcomes suck is because you're not giving us the right environment to work in. You're not giving us the right staff. So how can you tell us to improve this environment? How can you keep giving us education? We got to do this, we got to do that. But you guys are just telling us what to do without making any kind of improvement. You're telling us, once again, to work harder and work with less when we really, really need more, and patients are suffering. Not just the nurses, but patient outcomes are dropping specifically and directly because of your choice of not to better these conditions and not provide the appropriate staff. The outcome was that the strike was averted and they agreed to a new contract that is now going to start in November. I guarantee you got a nice bump in pay, better working conditions, another W for nurses, another W for patients, and a W for California. Another one in May, this one y'all might have heard about. It was the HCA healthcare strike in California with about 3,000 nurses. And their concerns were a staffing shortage, poor retentions, and a lackluster working condition. The outcome was that the 5 hospitals that were striking started negotiating with the hospital, so the strike was able to be averted. The outcome was that the 5 hospitals that were protesting were able to avert the strike because they entered negotiations with the hospital. So the strike was averted, and they got into an agreement for a 15% increased pay over 3 years, more benefits for education, health, and retirement. And also they agreed on future higher investments in staffing and work conditions. So they got a pretty good deal. Better benefits for their future, more money for their future, and also the hospital said it was willing to invest a larger amount of money into staffing and the whole nursing work environment. Another W for nurses, another W for California. In June, we had St. Charles System Bend in Oregon protest with 1,000 nurses for better staff, better work environments, and better pay. The outcome was that the strike was averted. They don't have anything signed yet, but currently what's on the table is better pay, guaranteed breaks. And what's interesting is they also had something in their contract where if there's a change of ownership in the hospital, then everything they agree on has to also get abided by. So I'm curious if maybe there were some talks of the hospital getting bought out by someone or changing some kind of corporate ship or just changing some managerial aspect of things. Because lots of times if somebody gets bought out by somebody or things change in management, name change, all that kind of stuff, what changes also is whatever negotiations that the nurses came to it also then they go away. If you get bought out by somebody, they're your new owner technically, so you have to once again then negotiate with them. So it's interesting that they threw that in. So right now they are waiting for the nurses to agree on this and sign this contract and finally put it into play. But this is also a really good deal. Win for Oregon, win for nurses. In June, we also had New York Presbyterian Brooklyn Methodist Hospital also go on strike with about 1,200 nurses for unsafe cutting of nursing staff. So this is interesting. So this hospital was undergoing shortages to begin with, and they decided to cut some more nurses over the last couple of years, which is wild because we had the whole widespread infection happen, needed nurses, and the hospitals did take a hit, but instead of trying to cut costs somewhere else, this hospital tried to cut costs by lowering their nursing staff, which was already burdened to begin with. The outcome was that the strike was averted and the New York Nurses Association came to a contract agreement for higher pay. I think it gets 18% over the next 3 years and then some retroactive pay. So nurses got what they wanted. And shout out to New York, man. They've been really pulling these strikes and these protests for these nurses to show W for nurses, W for New York. And shout out to New York for stepping up. New York took one of the biggest hits during the whole infection that was going on these last couple of years. So it's about time they stand up for what is right and stand up for what they deserve. Also in June, some Providence, Portland hospitals were going to go on strike, about 1,800 of them, for unfair labor practices, not wanting to negotiate their contract. They had a contract in 2022 that they started negotiating, and then the hospital just kind of fell off with the negotiation. So they were fighting for a new and renewed contract, as well as better ratios, better working conditions, better retention, all that other good stuff that nurses should have. And the outcome is that they are currently negotiating the contract. So I tried to find some more information about this, and lots of the stuff I looked at was saying that because they're negotiating, they can't really disclose what's going on because they're in the midst of talking. So hopefully they're doing well. Shout out to the nurses of Providence and Portland, Oregon. I'm taking this as a win for Oregon and a win for the nurses. That is all for today, guys. Thank you for tuning in. Thank you for listening to me discuss and talk about the nursing strikes and all these strikes that we've so far went through in 2023. It's good to see nurses stand up for themselves and stand up for each other because this is long overdue. It was just really interesting looking up all this information, actually realizing how much nurses and how much units actually go on strike makes you really think about if this stuff is actually effective. And I could tell you right now, right off the bat, doing all this research, looking up all this kind of stuff, it seems like it's really, really worth it, especially if you're in these situations that aren't ideal for nurses. At the end of the day, we have to stand up for our rights. We have to stand up for what we believe in, and we got to stand up for our patients, because a better working condition for ourselves, better staffing, better pay makes us perform better, makes us enjoy our job more, and ultimately it's going to also mirror the patient care and the patient outcomes. Thanks again, guys. Have an amazing week.